I'm Odd Hanssen. I'm a development economist working in the health portfolio, specifically on health financing for Oxford Policy Management. There are many things that need to happen in order to reach universal health coverage. First, countries need to plan and prioritize what health interventions they need to implement or scale up. Second, they need to figure out how much it's going to cost to actually add these health interventions or services or scale them up to a greater percentage of the population. And then third, once there is an estimate of how many more resources will be needed, they have to figure out where they will get these funds, how they will mobilize additional financing for these services. Countries also have the ability to prioritize or seek to prioritize health as something of strategic national importance, which means that the budgets or the ministries of finance can give more money to health out of the big pool or the pie that is distributed between different sectors, which is an important way that countries can mobilize more resources for health. In addition to thinking about additional financial resources or financing, countries need to imagine how their system can be made more efficient. And this considers taking the same number of health workers or medicines and reorganizing them in a way that gets you to a greater amount of health produced at the end, meaning thinking about how to prevent diseases instead of curing them afterwards. Another way that countries can think about doing this, becoming more efficient, is to go outside of the health system box and think about issues within public financial management. And just thinking about what happened in the way money moves around the health system and making sure that the right amount of resources arrive at the right places at the right time. As OPM, there are different ways that we work and support governments in their efforts to move towards universal health coverage. And one of the things that we are highlighting more and more as we go forward is that all the different ways that we have looked at helping governments still sit within this link of steps that start from planning and go to the end in implementation, and that if a project, even if it only focuses on one area, like physical space analysis, or only looks at efficiency changes or improvements in the financing of the system, it still fits as just a part of this step that countries should be trying to constantly think about, and that you cannot really hope to get substantial improvements towards the Sustainable Development Goals unless you think about how this fits within a longer-term priority setting or a longer-term efficiency improvement in your system and sort of beyond the system as well. So as OPM, we want to help countries think about how every issue within health financing links to a wider movement towards UHC, and that countries shouldn't only look at things like the cost of a national health plan or only the way in which a PFM system should be improved, but how all of these fit within the movement from having a good idea and of what the priorities of the country are and the actual implementation and outcomes of those. And that we shouldn't forget about all the other steps and driving factors that are important in improving a health system outcome and the eventual attainment of the Sustainable Development Goals in health.